Welcome again, beloved seniors. Welcome to part 2 of Sex Life Over 60. May I remind you that 40% of people between 65 and 80 are still sexually active? And here's something even more surprising. 73% of them report being satisfied with their sex lives. If you've been wondering whether intimacy after 60 is normal or healthy, you're in the right place. Today we're busting more myths and sharing what recent studies tell us about senior relationships, and why doctors are now encouraging intimate connections as we age. Your changing body. What to expect. As we get older, our bodies naturally go through changes that affect our sexual health. These changes are normal, but they can bring new challenges to intimacy. For women, menopause causes important shifts in the body. Many experience vaginal dryness, which can make sex uncomfortable. The vaginal tissues often become thinner and may shrink slightly. These changes can lead to pain during intercourse if not addressed. Some women also notice shifts in their sex drive, sometimes stronger, sometimes weaker, as their hormone levels change. Men face their own set of changes as they age. Erectile dysfunction becomes more common, making it harder to get or maintain an erection. Even when things work, orgasms might feel shorter or different than before. Many men need more time between sexual encounters as they get older. These changes can leave men feeling frustrated or worried about their sexual performance. It's common for both partners to feel some concern about how these changes will affect their relationship. These physical changes also bring some health considerations. As we get older, our immune systems don't work as well as they used to. This makes us more vulnerable to sexually transmitted infections. HIV, syphilis, and other STDs can affect seniors too. Some older women face higher HIV risks due to vaginal changes that happen after menopause. Thinning vaginal walls can tear more easily during sex, creating openings for viruses to enter the body. Many older couples stop using condoms since pregnancy isn't a concern, but this leaves them unprotected against infections. The effects of these infections can be more serious for older adults. A weakened immune system means HIV can progress to AIDS faster in seniors. Some early HIV symptoms like fatigue and body aches get mistaken for normal signs of aging. This leads some people to delay getting tested until they're quite sick. Older adults with HIV often develop age-related health problems earlier than others. Heart disease, bone loss, memory issues, and some cancers become more likely. These health challenges can make maintaining an active sex life more difficult. All these changes might sound discouraging, but they're simply facts of aging that we can address. Many couples find ways to adapt and enjoy intimacy well into their later years. There are solutions for vaginal dryness and erectile difficulties. Safer sex practices remain important for older adults too. Understanding what's happening with your body helps you make informed choices about your sexual health. While our bodies change, that doesn't mean satisfying intimacy has to end. Different positions, more time for arousal, and open communication can help partners stay connected. A slower pace often works better as we age. Some couples find they enjoy different kinds of physical closeness just as much as traditional intercourse. The key is being willing to adjust your expectations and try new approaches. Medical professionals can offer helpful suggestions for maintaining sexual health. They might recommend vaginal moisturizers, hormone treatments, or erectile dysfunction medications. Talking openly with your doctor about these issues often leads to practical solutions. Many people feel embarrassed discussing such personal topics, but doctors hear these concerns regularly. Getting professional advice can make a big difference in your comfort and satisfaction. At this stage of life, being gentle with yourself and your partner matters most. Physical changes don't reflect your worth or the strength of your relationship. With some adjustments and patience, many couples discover they can enjoy sex even more as they age. The next section will look at how often seniors typically remain sexually active and what factors influence this. So, how often are seniors really having sex? A 2010 study found that sexual activity varies quite a bit among seniors. About half of partnered men over 65 reported being sexually active in the past 6 months. For partnered women in the same age group, the number was slightly lower at 40%. This shows that many couples continue intimate relationships well into their later years. The difference between men and women's activity levels suggests that gender plays a role in how often seniors engage in sex. When looking at single seniors, the gap becomes much wider. Only 13% of single men over 65 said they had been sexually active recently. For single women, that number drops to just 1%. These statistics highlight how having a partner makes a big difference in sexual activity after 60. Single women, in particular, report far less engagement in sex than their male counterparts. There are several reasons for these gender differences. For women, menopause brings physical changes that can make sex uncomfortable. Vaginal dryness and thinning tissue can lead to pain during intercourse, which might discourage some women from staying active. Hormonal shifts can also lower libido, making sex less appealing over time. Another factor is simply the lack of available partners. Women tend to live longer than men, so older single women may not have as many opportunities to form new relationships. For men, staying sexually active often depends on health. Erectile dysfunction becomes more common with age, but many men find solutions like medications or devices to help. Men who remain sexually active often do so because they still have a willing partner. When men lose their partners, they may struggle to find new ones, but they still report higher activity rates than single women. Cultural expectations also play a role. Society often assumes that older women aren't interested in sex, which can discourage them from pursuing intimacy. Men, on the other hand, may feel more social permission to remain active. These attitudes make it harder for older women to express their desires or seek new relationships. Health issues affect frequency as well. Conditions like heart disease, diabetes, or arthritis can limit physical activity, including sex. Depression or stress can also reduce interest in intimacy for both men and women. Some medications prescribed for common senior health conditions may lower libido as a side effect. Despite these challenges, many couples find ways to stay intimate. Adjusting expectations can help. Sex doesn't have to mean the same thing at 70 as it did at 40. Slower pacing, different positions, and more focus on emotional connection can all make sex more comfortable and enjoyable. Open communication between partners is key to finding what works best as bodies change. For singles who want to stay active, there are options. Dating websites for seniors have become more common, offering new ways to meet potential partners. Some older adults explore relationships with multiple partners, though this requires careful consideration of STI risks. Others find that self-pleasure or intimate non-sexual connection satisfies their needs for closeness. The most important takeaway is that sexual activity after 60 is common, especially for those with partners. And while women tend to report lower activity rates overall, the right solutions can help anyone maintain intimacy if they choose to. The next section will explore how communication is important in maintaining a healthy sex life after 60. Talking about sex, communication strategies. Having open conversations about intimacy might feel uncomfortable at first, but it's worth pushing through that discomfort. Many couples find that talking honestly about their changing needs actually brings them closer together. Start by choosing a relaxed time when you're both comfortable, not right before or after being intimate. You might say something like, "I've been noticing some changes in how my body responds lately, and I'd love to talk about how we can make things more comfortable for both of us." This approach keeps the conversation positive and solution-focused rather than critical. It's common to feel nervous bringing up sensitive topics like erectile dysfunction or vaginal dryness. Try using we statements instead of you statements to avoid making your partner feel blamed. For example, I think we might both notice our bodies responding differently these days. What if we explore some new ways to enjoy physical closeness? This invites problem-solving together rather than putting pressure on one person. If words feel too difficult, consider writing down your thoughts first, or even sharing an article about senior sexuality as a conversation starter. When discussing specific physical changes, plain language often works best. For vaginal dryness, you might say, "Sometimes intercourse feels uncomfortable now. Maybe we could try using lubricant or explore other types of touch." For erection challenges, try, "I notice my body sometimes needs different stimulation now. What if we take more time with foreplay?" Keeping the tone matter-of-fact helps remove embarrassment. Remember that your partner is probably experiencing their own changes and may feel relieved you brought it up first. Introducing new ideas into your intimate life requires gentle communication. If you want to try something different, approach it as an experiment rather than a demand. You might say, "I read about couples our age enjoying massage more. Would you like to try giving each other back rubs first?" Or, "What if we set aside time just for cuddling and touching without worrying about sex?" Suggesting temporary changes often feels less threatening. "Let's try this once and see how it feels" works better than announcing permanent shifts. Talking to your doctor about sexual health is just as important as discussing other health concerns. Many older adults avoid these conversations, but doctors are trained to help. Prepare for your appointment by writing down specific questions like, "Could my medications be affecting my sex drive?" Or, "What options exist for making intercourse more comfortable?" If you feel embarrassed, remember that doctors discuss these issues daily. Starting with general terms often helps. Saying, "I'm having some challenges with intimacy," lets your doctor ask follow-up questions. For singles starting new relationships later in life, early conversations about expectations can prevent misunderstandings. Try saying, "I'm very attracted to you. Intercourse isn't always comfortable for me now, but I'd love to explore all the other ways we can enjoy each other." This keeps the focus on pleasure rather than limitations. If you're not in a monogamous relationship, discussing STI testing is essential. You might say, "Before we become intimate, I'd like us both to get tested. I care about keeping us both safe." Presenting it as mutual care makes the conversation easier. Couples accustomed to one pattern of intimacy may need help adjusting. Scheduling special pleasure dates with agreed boundaries can help. For example, decide together that the first date will focus on giving pleasure and the second on receiving it, without intercourse. This removes pressure and helps partners rediscover each other's bodies. If communication remains challenging, a sex therapist can offer neutral guidance. Many couples find that a few sessions help them develop new ways to connect physically that work better for their current needs. The key is remembering that good communication about intimacy takes practice, especially after years of established patterns. Start small, be patient with each other's discomfort, and celebrate the increased closeness that comes from honest sharing. Even if the first conversation feels awkward, keep trying. Most couples find it gets easier with time. How you talk about intimacy matters just as much as what you say. A gentle touch, reassuring words, and willingness to listen go a long way toward maintaining connection through life's changes. With medical advances offering more options than ever, there's good reason to keep these conversations going. When health gets in the way, medical solutions. Health changes don't have to mean the end of your intimate life. Many common issues that come with aging have practical medical solutions. Let's look at what's available today to help maintain fulfilling relationships. Vaginal dryness affects many women after menopause due to lower estrogen levels. This can make sex uncomfortable or even painful. Lubricants help reduce friction during sex. Water-based ones are safe to use with condoms and sex toys. Silicone-based lubricants last longer but shouldn't be used with silicone toys. Some women find relief with vaginal moisturizers used regularly, not just during sex. For more lasting relief, low-dose estrogen therapy comes in several forms. Creams are applied directly to the vaginal area. Estrogen tablets can be inserted into the vagina. Rings release small amounts of estrogen over time and get replaced every few months. These treatments help restore vaginal tissue and natural lubrication. Erectile dysfunction becomes more common as men age. Medications like Viagra and Cialis help many men by increasing blood flow to the penis. These usually need to be taken about an hour before sex and work for 4 to 36 hours depending on the type. Vacuum pumps are non-invasive options. A tube goes over the penis and creates suction to draw blood into it. A special ring then holds the erection. For men who don't respond to other treatments, penile implants may be an option. These are surgically placed devices that allow men to control when they have erections. It's important to talk to your doctor about ED, because it can sometimes signal heart disease risks. Low sex drive affects both men and women with age. For men, testosterone levels naturally decline over time. Testosterone replacement therapy can help but needs medical supervision. Too much testosterone can increase prostate cancer risks. Women's libido often changes due to hormonal shifts after menopause. Some medications like antidepressants can also lower sex drive. Counseling helps many couples address emotional factors affecting intimacy. Vyleesi is a newer medication that can boost libido in women when taken before sex. Pain during sex isn't something you need to live with. Beyond lubricants for dryness, different sexual positions often help. Positions where the woman controls depth of penetration usually cause less discomfort. Pelvic floor exercises strengthen vaginal muscles and may reduce some types of pain. For severe pain, physical therapists specializing in pelvic health can help. Some medications used for nerve pain might also help with sexual discomfort for both men and women. Heart disease can create concerns about sexual activity. Most people with stable heart conditions can safely have sex. Cardiac rehab programs often include guidance on resuming sexual activity. Blood pressure medications sometimes cause sexual side effects, but alternatives usually exist. Don't stop heart medications without discussing this with your doctor. Sexual activity burns about as many calories as climbing 2 flights of stairs, not as strenuous as many people fear. Diabetes affects sexual function in several ways. Nerve damage can reduce sensation. Circulation problems might contribute to ED. Keeping blood sugar well controlled helps prevent these issues. Some diabetes medications might lower testosterone levels in men. Regular checkups can catch these changes early when they're easier to treat. Arthritis and joint pain don't have to stop intimacy. Trying different positions that don't stress sore joints helps. Having sex in the morning often works better when stiffness is less. Warm baths before sex can relax sore muscles. Extra pillows provide support for painful areas. Some couples find side-by-side positions most comfortable. Water-based lubricants can help when arthritis makes manual stimulation difficult. Prostate issues affect many older men. After prostate surgery, erections often take time to return. Medications and devices can help during recovery. Radiation treatment for prostate cancer also commonly causes temporary ED. Some men regain function naturally within 2 years. Pelvic floor exercises help with urinary control after prostate treatment and may help sexual function too. Remember that most sexual health issues have multiple treatment options. What works for one person might not work for another. Your doctor can help you weigh benefits and risks of each approach. Many people try several solutions before finding what works best for them. The key is not giving up after the first attempt doesn't solve everything. With patience and the right help, satisfying intimacy is possible at any age. Next, we'll explore how to bring new energy to your relationship when dealing with these changes. Revitalizing your sex life after 60. Revitalizing your sex life after 60 starts with rethinking what intimacy means. Sex and relationship coach Charlie Glickman notes that intercourse is just one option among many for pleasure and connection. Exploring new ways to be intimate can open up fresh possibilities you might not have considered before. Many couples find satisfaction in sensual touching, massage, or simply spending quality time together in ways that feel physically connecting. The key is being willing to expand your definition of what counts as meaningful intimacy. Small changes in routine can make a big difference. Trying new positions takes pressure off areas that might cause discomfort. Many older couples find side-by-side positions work well when joints are stiff. Some switch to having sex in the morning when they have more energy. Changing locations can help too. If the bedroom feels too routine, trying another room might bring new energy. Taking breaks during intimacy helps manage fatigue while still allowing for close connection. For many older adults, laughter and playfulness improve intimacy. Sharing fun activities outside the bedroom often leads to better connection inside it. Trying a new hobby together or reminiscing about happy memories can spark affection. According to Glickman, enjoying new experiences together may boost both mood and libido. Maintaining a sense of humor about physical changes helps partners navigate them without embarrassment. Sometimes the most satisfying moments come from simply enjoying each other's company without performance expectations. Single seniors have options too. Online dating sites specifically for older adults provide ways to meet potential partners. These platforms allow you to be upfront about what you're seeking, whether that's companionship, romance, or physical intimacy. Starting conversations online can feel less intimidating than approaching someone in person. Taking time to get to know someone new at your own pace often leads to more satisfying connections when you do decide to become physically intimate. Sex toys offer practical solutions for many older adults. Vaginal dilators help gradually increase elasticity for women experiencing discomfort. Water-based lubricants reduce friction while being safe for use with most toys. For men, vibrating stimulators can enhance sensation when erection difficulties occur. Many couples find incorporating these tools opens up new avenues for pleasure they hadn't explored before. There's no shame in using aids that help maintain satisfying intimacy. They're simply practical solutions to common challenges. Lifestyle changes can dramatically impact your sex life. Regular physical activity improves circulation, which benefits sexual function for both men and women. Even gentle exercises like walking or swimming make a difference. Eating a heart-healthy diet full of fruits, vegetables, and healthy fats supports overall vitality. Limiting alcohol helps too, as drinking more than one serving per day may interfere with sexual response. Getting quality sleep matters more than many realize. Being well-rested makes intimacy much more enjoyable. Safe sex remains important later in life. Using condoms protects against STIs, which affect seniors more than many realize. Water-based lubricants work well with latex condoms, while oil-based products can damage them. For oral sex, dental dams provide protection. These thin sheets create a barrier between mouth and genitals. Single seniors starting new sexual relationships should discuss STI testing with potential partners. Being proactive about safety allows you to enjoy intimacy with peace of mind. Medical solutions can help when natural approaches aren't enough. ED medications like Viagra and Cialis improve blood flow for many men. Women experiencing vaginal dryness may benefit from localized estrogen treatments. Testosterone therapy helps some men with low libido, though it requires medical supervision. Physical therapy addresses pelvic floor issues that might interfere with comfort. Seeing a doctor about sexual health concerns leads to solutions you might not discover on your own. The best approach combines several strategies. Trying one new thing at a time prevents feeling overwhelmed. Starting with simpler changes like adjusting positions or scheduling often builds confidence for further exploration. Many couples find that discussing fantasies or long-held desires they never previously expressed brings excitement back into their relationship. Others thrive by focusing more on emotional connection rather than physical performance. The right path varies for each individual and couple. What matters most is staying open to experimentation and maintaining honest communication with your partner or potential partners. With patience and creativity, fulfilling intimacy remains possible at any age. Thank you so much for being with us to this point. All in all, intimacy after 60 isn't about turning back the clock. It's about discovering what works for you now. The research we've discussed shows that with open communication, healthy habits, and medical guidance when needed, your later years can include meaningful connections. From finding comfortable positions to exploring new forms of closeness, there are countless ways to maintain intimacy. Doctors agree that staying physically and emotionally connected benefits both health and happiness. We'd love to hear your experiences. What's worked for you? Remember, your golden years deserve golden moments. Share your thoughts below, and let's keep this important conversation going. Dear cherished friends of beloved seniors, as we wrap up for now, our hearts are full of gratitude for the time we've shared together. What a joy it is to walk this journey with you. We lovingly wish you a life of connection, comfort, and joy, including in the tender and meaningful parts of love and intimacy that keep the spirit young. May your days be filled with good health, gentle laughter, and the peace that comes from knowing you are deeply valued. Until we meet again, take care of yourselves, shine brightly, and remember, you are never alone on this path. With warmth and care, the Beloved Seniors Team.